Hey guys, today I want to talk about understanding the antipsychotic medications that are most commonly used to treat schizophrenia. I know when I talked about schizophrenia, I mentioned a whole bunch of different medications and side effects, and I'm going to get into that more today. So first, antipsychotic medications are drugs used to manage the symptoms of schizophrenia, such as delusions, hallucinations, and disorganized thinking. They work by altering the neurotransmitters in the brain, particularly dopamine and serotonin. And there are two main types of antipsychotic medications. We've got our first generation typical antipsychotics, which include Thorazine, Haldol, Prolixin, and Trilofan. Our second generation atypical antipsychotics include Risperdal, Zyprexa, Seroquel, Abilify, and Clozaril. So the side effects are pretty common amongst all of the medications, but they can be specific to each individual and vary in response, particularly depending on the dosage. But some common side effects are drowsiness, weight gain, dry mouth, blurred vision, constipation, and dizziness. Now, there are also some serious side effects that need to be addressed immediately, and these are things that we also monitor for. We've got tardive dyskinesia, which is involuntary muscle movements, neuroleptic malignant syndrome, NMS, which is a life-threatening condition that is characterized by a high fever, muscle rigidity, and altered mental status. There's also metabolic syndrome, which is weight gain, high blood sugar, and high cholesterol. There is an increased risk of diabetes. There's heart rhythm disturbances that can occur. So all of these things are monitored by providers on a regular basis. And I mentioned that some of these side effects are serious. In particular, the tardive dyskinesia, the neuroleptic malignant syndrome, and the metabolic changes. And those are seen more with the second generation antipsychotics, with the weight gain, increased blood sugar, and cholesterol levels, which can lead to diabetes and cardiovascular issues down the road. Most of these medications also require lab testing frequently. And there's baseline monitoring, so the weight and BMI of the patient on initiation of the medication, and then every 6 months they'll be monitored. They do a fasting blood glucose and a lipid profile when the medication's initiated, and then annually. And then a complete blood count, a CBC, on initiation and periodically as needed if the doctor thinks there may be some changes that are happening. Also, an electrocardiogram and ECG to monitor heart rhythm, especially for medications that are known to have cardiac risks. And then for Clozaril, there's specific white blood cell count monitoring and absolute neutrophil count monitoring. It's done weekly for the first 6 months, and then every 2 weeks for the next 6 months, and then monthly thereafter. So even though these medications carry great risks, they play a crucial role in managing schizophrenia. It's important to be aware of their side effects, the potential dangers, and the need for regular lab testing and monitoring by the providers. If there's any questions, please feel free to ask. And I'm going to talk a little bit more in another segment about tardive dyskinesia specifically, and a couple other of the serious side effects we see with psychotropic medications. And I'll see you later. Hi again, everybody. I want to talk a little bit more about antipsychotic medications and how they are used to treat non-psychotic disorders. We call this off-label use for antipsychotic medications. They may be prescribed, in conjunction with other medications, and they do offer great benefit for those who need them. So some common uses for off-label antipsychotic medications would be for insomnia. Some antipsychotics like Seroquel are prescribed at low doses to help with sleep problems, particularly when traditional sleep medications don't work. It's also used for, certain antipsychotics are used for anxiety disorders. Olanzapine, which is also known as Zyprexa, Abilify, are sometimes used to manage severe anxiety in cases where traditional antidepressants or other anxiety medications are just not cutting it. They're not doing the job. Some antipsychotics are used to treat depression or in conjunction with antidepressive medications. Especially the second generation antipsychotics like Abilify and Seroquel are used alongside antidepressants to treat major depressive disorder in people who the medications they're currently on are working, but not quite enough to relieve them of all their depressive symptoms. It could also be used for PTSD, post-traumatic stress disorder, especially with some veterans. Individuals with PTSD are prescribed antipsychotics like risperidone to help with those intrusive thoughts and emotional dysregulation. Another off-label use for an antipsychotic is with dementia-related agitation. In older adults with Alzheimer's and other forms of dementia, antipsychotics are sometimes used to manage their aggressive behaviors, although there are significant risks with using antipsychotics in older adults. It's usually done in low doses. Antipsychotics can also be used to help manage and treat Tourette syndrome and tics, like risperidone. They're sometimes used to control the muscle tics in individuals with Tourette's when other treatments aren't effective. So, affecting their daily life, individuals taking off-label antipsychotics can be both positive and can be challenging. They provide relief from symptoms that interfere with their daily life, such as the anxiety and the chronic sleep disturbances and uncontrollable movements. However, it can also cause the drowsiness, the weight gain, and difficulty concentrating, as we see are common side effects of antipsychotics. And this may interfere with work and social life and overall quality of life. So it's a discussion that would definitely need to be had between the individual and their provider, and pros and cons outweighing the benefits versus the risks. It would be an individual decision and in conjunction with the provider. And I've talked in great deal about side effects of antipsychotic medications, and we can see a lot of times the most common ones are the drowsiness, the sedation, weight gain, and the increased risk of diabetes, especially in long-term use, and then potentially tardive dyskinesia with, again, long-term use of these heavy-duty antipsychotics, especially in higher doses. And the risk for using antipsychotics in older patients and the elderly is there's increased risk of mortality, increased risk of stroke and death, because it does have the risk of increasing cholesterol and cardiovascular issues. The metabolic effects, the weight gain, the cholesterol, the high blood sugar, they can all contribute to long-term health problems, which, especially in the elderly, they may already have issues with. Stopping antipsychotic medication suddenly can actually cause withdrawal symptoms, such as nausea, dizziness, and sleep disturbances, so they should always be tapered and under medical supervision from your provider. Off-label antipsychotics are used with great benefit to many individuals whose medications are not quite reaching the effects that they want to treat their anxiety and depression and PTSD. And it is a great conversation to have with a provider if you are experiencing, continued symptoms with your traditional medications, and maybe adding a low dose antipsychotic may help relieve the rest of your symptoms. So talk to your provider, and hopefully you can get some relief if you need it. If you have any questions, please let me know. Like, follow, and share, and I will see you next time.